So good afternoon, everyone, and welcome to this side event of Upholding Health Equity, Access to Medical Products, and Reproductive Rights. South Centre, we're very pleased to be co-hosting this event together with the mission of South Africa to the UN and other international organizations, Ambassador Nkosi with us, and with the mission of Brazil also to the United Nations. Be shortly introducing our key speakers. We note that we do have Precious Matoso, who was the chair of the WHO pandemic treaty negotiations, who will be unable to be with us today. She sends her regrets as being ill. So today, colleagues, we will be speaking on key opportunities and challenges for advancing health equity, with a focus on advancing access to medical products, including medicines, vaccines, diagnostics, as well as advancing sexual and reproductive health and rights. And two key elements are cooperation and solidarity as pillars to advance globally the right to health. So we view that this discussion is very timely. We note that the Human Rights Council is expected to adopt a resolution on access to medicines, vaccines, and other health products in the context of the right to health, as well as different important contextual developments, including the recent adoption of the WHO pandemic agreement. We also have several reports that are very relevant being presented to this Human Rights Council, as well as the recent declaration of the Group of 20 Health Ministers, Rio de Janeiro, which highlighted the importance of these issues to the full realization of the right to health. I'd just like to note that the South Centre also has a number of recent publications on these issues that we would invite you to reference further. So without further ado, I'd like to give the floor to Ambassador Nkosi. Thank you very much for being with us, sir.
Thank you very much, Viviana, for the very kind, very warm introduction. And let me take the opportunity to greet my colleagues, fellow esteemed ambassadors, excellencies, greet delegates, and indeed greet the esteemed members of the panel. It is indeed a great honor for South Africa to be part of this important side event, co-hosted by the Permanent Mission of Brazil, the South Centre, and indeed the Permanent Mission of South Africa, which, as the moderator has indicated, is focused on challenges, experiences, and opportunities in advancing the agenda for health equity, sexual health, and reproductive rights. South Africa's priorities in this area are guided and derived from the Constitution of the Republic, its foreign policy, and its National Development Plan, which has a long-term vision of ensuring that all South Africans attain a decent standard of living through the elimination of poverty and reduction of inequality. South Africa holds a proud reputation as one of the countries globally with progressive legislation and health policies in advancing sexual health and reproductive health and rights, SRHR. Our Constitution is deeply rooted in the principles of equality, dignity, and social justice, and explicitly guarantees the right to access to reproductive health care services. I would like to, Madam Moderator, Excellencies, highlight in detail some of the priorities and ongoing efforts for upholding and advancing health equity, specifically concerning access to medical products and the protection of reproductive rights, as this is our theme for this afternoon. South Africa recognizes the fundamental human rights of access to healthcare services. This right is not merely a legal pronouncement, but a guiding principle for our national health policies. We are acutely aware of the historical inequalities that have shaped our health landscape and was systematically dismantling these disparities. Therefore, for South Africa, equitable access to medical products, including vaccines, medicines, and diagnostics, is a cornerstone of the right to health and critical for global health security, particularly for pandemic prevention, preparedness, and response. In the midst of the COVID-19 pandemic, access to vaccines, diagnostics, and therapeutics was our biggest challenge. The pandemic indeed revealed deep inequalities between and within states, and a rising trend of nationalism and a retreat from international health cooperation and solidarity. The commitment to address disparities in South Africa started immediately after the democratic breakthrough in 1994, when the late President Nelson Mandela, during his first 100 days in office, made an announcement of free healthcare services at public health facilities to pregnant women and children under the age of 6, a policy to correct the inequalities of the past, improve access to health, as the country was pursuing equity for good health outcomes as enshrined in South Africa's founding documents. We continue to strengthen our primary healthcare system as the bedrock of our health service delivery. This includes expanding outreach services through community health workers and implementing innovative medicine dispensing models to improve accessibility, particularly in rural and underserved areas. A cornerstone of our health equity strategy is the progressive implementation of the National Health Insurance. The NHI aims to provide universal health coverage, ensuring that all South Africans, regardless of their socioeconomic status or geographical location, have access to quality healthcare services free at the point of care. The NHI bill passed by our National Assembly signifies a key milestone in this journey, fostering greater collaboration between our public and private health facilities. South Africa's efforts also extends to access to financial support through donations of, especially during the COVID-19 pandemic, for example, 5 million doses of Pfizer vaccines and 10 million doses of the J&J vaccine to other African countries. It was also demonstrated through the contribution of $10 million to the Global Fund and the financial support to the ACT Accelerator, which was co-chaired by Their Excellencies President Ramaphosa and the Prime Minister of Norway. This was the basis of our call for a funding mechanism in order to ensure that there is international solidarity and cooperation, also in anticipation of the negotiation and the conclusion of an agreement on pandemic preparedness and response. We recognize that a strong health system is only as good as its workforce. Our 2030 Human Resource for Health strategy emphasizes the critical need for sufficient numbers of well-skilled, enabled, and supported healthcare workers across all cadres, from community health workers to specialists, to achieve universal health coverage. We acknowledge that the challenges persist, particularly concerning the consistent availability of essential medicines. Issues such as takeouts, especially in rural clinics, are a serious concern. We're actively working to address these through improved human resource management, unified procurement models, and enhanced information management systems to ensure a robust and reliable supply chain for essential medical products, including ARVs and TB medications. Our goal is to ensure that life-saving medications are always available to those who need them. Despite our progressive legal framework, we also acknowledge that significant inequalities continue, particularly for marginalized groups such as rural women. Challenges include long distances to access services, lack of awareness about SRHR, and prevailing stigma, especially concerning HIV/AIDS. We're committed to investing in rural healthcare infrastructure, ensuring adequate staffing and raising awareness to dismantle harmful cultural stigmas and ensure that all women can exercise their reproductive autonomy. Madam Moderator, Excellencies, distinguished ladies and gentlemen, at the continental level, President Ramaphosa is the champion on pandemic prevention, preparedness, and response in the context of the African Union. And pandemic preparedness, prevention, and response is also one of the 5 priorities of the G20 presidency that South Africa currently holds. President Ramaphosa has been an ardent advocate for the development and strengthening of regional production capacities. His vision for a common agenda for manufacturing vaccines, medicines, and diagnostics, therapeutics, and other healthcare products on the African continent has been endorsed unanimously by the Assembly of AU Heads of State and Government. For us, manufacturing capacity for vaccines locally is an important step towards self-reliance for Africa to meet its developmental aspirations. In this regard, we're delighted that South Africa's mRNA hub for vaccine manufacturing is standing out as a center of excellence and model for other hubs across the continent. While production capacity is critical and will not be complete without ensuring access to markets, South Africa continues to advocate for health products that are produced in Africa to access the global market. The South African Health Products Regulatory Authority supports pre-qualification of products. As such, the realization of the AU Summit decision that at least 30% of products destined for the African market should be purchased in Africa is important. The same should also apply to the global supply chain and logistics network to be established to enhance, facilitate, and work towards removing barriers and ensure equitable, timely, rapid, safe, and affordable access to pandemic-related health products for countries in need, as outlined in Articles 13 and 14 of the recently approved WHO Pandemic Agreement. Amidst the growing political tensions, economic uncertainty, and the climate crisis, the need for multilateralism and strong partnerships remains key. South Africa consistently calls for renewed solidarity to address the ongoing backlash against women's rights and reproductive freedoms globally. We need more and not less international health cooperation and solidarity. In conclusion, South Africa remains steadfast in its commitment to upholding health equity and protecting reproductive rights as integral components of our human rights agenda. While we have made significant strides, we're acutely aware of the work that still needs to be done. We're dedicated to continuous improvement, learning from our experiences and those of others, collaborating with international partners to ensure that all individuals in South Africa and beyond can enjoy the highest attainable standard of health and exercise their fundamental human rights with dignity and autonomy. I thank you.
Thank you so much, Your Excellency, Ambassador Nkosi. We've heard of the important leadership of South Africa in upholding health equity, advancing universal health coverage, and of course, addressing the issue of the importance of sexual and reproductive health rights overall, women's rights, and the importance of addressing this in this current context in particular, where we hope we all together can be advocates of these important issues and the way forward. I will now turn the floor to Dr. Tlaleng Monokeng. She is Dr. T, the Special Rapporteur on the Right to Health. Given her extensive agenda, as you know, for this Human Rights Council, she couldn't be here now in person, so she very kindly provided us with a recording. And what we had asked her is to briefly explain to us, how does international human rights law on the right to health establish obligations for access to medical products, as well as obligations for access to sexual and reproductive health and rights? So we turn to Dr. T. Thank you.
I am pleased to join this timely event co-hosted by the missions of Brazil and South Africa in the South Center. All people have a fundamental need for healthcare, yet inequalities in health status and access to healthcare services persists. The COVID-19 pandemic fostered a context perpetuating deep inequality, demonstrated by the rollout processes of COVID-19 vaccines and diagnosis, which favored wealthier countries at the expense of low and middle income countries. The COVID-19 crisis reminded the global community that the realization of the right to health is interdependent and indivisible and interrelated to many other human rights, and that in fact, the outcome of achieving the Sustainable Development Goals requires a different kind of global solidarity and equity in accessing essential health medicines. While private business entities and for-profit making businesses receive a reasonable compensation for their investments in research and vaccines, they should be reminded to refrain from invoking intellectual property rights in a manner that is inconsistent with the right of everyone to access safe and effective vaccines, for example, and that much of those investments already come from public in terms of tax. It is important that under the right to health, the key principles shape human rights that are of non-discrimination, equality, privacy, as well as integrity and autonomy and dignity. And this is important, especially in relation to sexual and reproductive health rights as well, which are an integral element of the right to health. And more importantly, it is important to remind all of us that sexual and reproductive health rights are important as recognized in Article 12 of the International Covenant on Economic, Social, and Cultural Rights and many other regional instruments and consensus documents. Sexual and reproductive health encompass the right to a pleasurable, satisfying, and safe sex life that is free from discrimination, coercion, as well as violence. Sexual and reproductive health rights are also grounded in the right to life, to dignity, to education and information, to equality before the law and non-discrimination, the right to decide on the number and spacing of children, if any, the right to privacy, the right to freedom of opinion and expression, the right to consent to marriage, as well as equality in marriage, and the right to be free from gender-based violence, harmful practices, torture, or ill treatment. Therefore, sexual and reproductive health encompasses maternal health care, contraceptive information, goods and services, safe abortion care, as well as prevention and diagnosis of many other gynecological diseases, treatment of infertility, reproductive cancers, sexually transmitted infections, HIV and AIDS, as well as, of course, trans-affirming healthcare. And we know that under the right to health, people are entitled as well to effective remedy for violations of fundamental rights. And more we see sexual and reproductive health rights becoming a space of gross human rights violations. And therefore, I would like to recall all of us that states have three primary obligations. The obligation to respect requires that states refrain from directly or indirectly interfering with individuals exercise of this right, including through reforming laws that impede the right to sexual and reproductive health. The obligation to respect requires that states prevent third parties, such as private sector, from imposing barriers to the enjoyment of this right. The obligation to fulfill requires states to adopt measures to ensure the full realization of the right to sexual and reproductive health. Some of the challenges, of course, historical, but of course, the living legacy of colonialism has perpetuated the patriarchal control and oppression of societies and the control of sexuality. And we know that bodies of women, girls, and gender diverse people have long been subjected to discrimination, violence, and oppression, where human rights violations have occurred unabated. And so both between and within countries, patterns related to sexual and reproductive health rights typically reflect social inequalities and power distributions based on income, gender, origin, citizen status, age, including even disability status, and systemic discrimination. So, for example, a person living within a low and middle income country face much higher rates of morbidity and mortality related to sexual and reproductive health rights than persons in higher income countries. We are witnessing a global patriarchal culture, a regressive climate and pushback in the area of sexual and reproductive health rights, and opposition to concepts such as gender equality. Gains have been made and gains will continue to be made, but we must be aware of the dangerous rolling back of rights, and especially those perspectives and opinions and the ways in which women, girls, and LGBTQI persons move through society and are allowed to have the freedom and autonomy to be themselves. The pushback is happening in how they are systematically and structurally sidelined through practices, but also through the use of the law and the courts. And so states must respect and protect key principles of non-discrimination, equality and privacy, as well as integrity, autonomy and dignity, and well-being of individuals, especially in relation to sexual and reproductive health rights, because so much fallout happens when violations happen in that particular instance. But when human rights are used as a common thread that connects all of us, we can really ensure that the rights of everyone, including some of the most vulnerable, are protected, promoted, and realized. And in the light of advancing health equity, intersectionality, which is a means through which we can get to substantive equality, it has transformative power in national legal and policy frameworks by ensuring that people who are most affected by these issues are also participating meaningfully. We ensure that these frameworks promote substantive equality to drive progressive jurisprudence in many countries. One such approach is looking at national normative frameworks, including at the role of legislation and litigations through the courts, which inter alia underlines the importance of the justiciability of the right to health. And it is with that goal that I wish that all of us can realize the right of everyone to the highest attainable standard of physical and mental health in our lifetime. Thank you.
We thank Dr. T for those very clear messages about how the human rights framework can really help advance those common goals of health equity, in particular in access to medical products, as well as addressing other avoidable inequities, including in the area of access to sexual and reproductive health and rights services and others. We'll now turn to Mariama Widner, who is a scientist with the team on maternal and perinatal health at the World Health Organization within the program of sexual and reproductive health and research. With Mariana, we had asked her if she could bring our attention to the role that the multilateral and public health agencies play in addressing the persistent inequities in access to quality to medical products that are essential for the area of reproductive health. So Mariana, to you, please.
Thank you very much, Viviana. Good afternoon, everyone. It's a pleasure for me to be here really today to discuss this such an important issue related to sexual reproductive health. The next. So I will pass some slides because it's pretty technical what I'm going to explain, and I want to get messages clear for you. So before answering to your question, Viviana, I would like to define what is access. So WHO defines access when medicines are available with the context of functioning health systems at all times in adequate amounts, in the appropriate dosage forms, with assured quality and adequate information, and at a price that individuals can afford. So access also is included in the SDG 3.8 when they say to achieve universal health coverage, including access to safe, effective, quality, and affordable essential medicines and vaccines for all. So the 5 main pillars when we are talking about access are availability, quality, affordability, sustainability, and equity. So access means more than having medicines on a shelf. It means ensuring that people, regardless of income, of geography, can obtain them safely, affordably, and with dignity. So it's not simply a technical challenge, it's a matter of health systems failure and a denial of human rights. So access to quality assured SRH medicines requires interventions from several stakeholders. And all these stakeholders, starting from innovations, manufacturing, procuring, prescribing, dispensing, and also pharmacovigilance once the product is in the market, needs strong collaboration. So if this collaboration does not exist, it's very difficult to ensure timely and equitable access of SRH medicines. So which are the SRH medicines that we are referring to? These are the medicines that we use in maternal health, abortion, contraception, STIs, reproductive cancers, menstrual health, menopause, and others. So the theory is nice. We know the chain when we want to develop the product and how to make it accessible at the bedside, but there are lots of inequities happening at each of the steps of this chain. For example, there are very few SRH new products in the pipeline. So we need SRH medicines, but there are no innovations in that area. Also, SRH medicines are not part of the national procurement priority list in many countries. This brings to stockouts and out-of-pocket expenditure. What does this mean? This means that, for example, a woman comes for an SRH, to an SRH clinic, needs a medicine, the doctor wants to give the medicine, but actually there are not enough volumes, so the hospital does not have enough medicine. So they ask the woman to go outside to the street and buy the medicine from the street, which is a market which is quite difficult to control, and it's very likely that that person will get a substandard medicine. Then there is where the market fills the gap with these substandard medicines. So the next, please. So I have an example. We have lots of examples, but I'm referring here to maternal health medicines. We did a survey, and we found that in general, in low and middle income countries, around 50% of the uterotonics, which is the life-saving commodity in maternal health to prevent and treat postpartum hemorrhage, is of substandard quality. This means that 1 every 2 women will receive water. That's why, the hospital then will spend more money trying to give more medicine in order to prevent or treat already this hemorrhage. So substandard medicines violate the right to universal health coverage, often harming those least able to bear the consequences. They waste public resources, undermine trust, and can lead to disability or death. So in general, there is limited awareness from low and middle income countries of the importance of sexual reproductive health and sexual reproductive health medicines. This gives low prioritization of SRH medicines in health policy and planning. There is an underfunding then of SRH medicine supply and services. So all this situation is persistent. All these persistent inequities apply always to sexual reproductive health and the medicines. So the situation not only underscores broader systemic challenges within health systems, but also represents a fundamental human right concern. So how is WHO and other international agencies collaborating to address these barriers? So we are working intensively with countries trying to set research agendas, enabling generation of new evidence related to new medicines. We formulate recommendations. We make all the process to include medicines in the essentials medicines list, and we pre-qualify the manufacturers. And we try to facilitate the adoption and implementation of norms and standards and provide technical assistance to strengthen regulatory systems. So we have to foster multi-sectoral collaboration to strengthen resilient health systems and to ensure the protection of people's right to health. So we need, and we are creating this ecosystem, this enabling environment, but we need the support from countries because political will and moral obligation is very important at country level. So low middle-income countries need policies and adequate budgets to prioritize quality-assured SRH medicines, and SRH and rights for all should remain always part of their agenda. Governments, donors, private sector, international agencies all share responsibility, and a coordinated multi-sectoral action is needed urgently. So, of course, delayed action translates into lives lost and rights denied. So WHO leadership remains a key driver in enabling every woman to realize her right to the highest attainable standard of care. We know we can do it because we have the Pandemic Accord, which serves as a very strong example of multilateral engagement in advancing critical health issues. And I can say that even if it's SRH, it's not a pandemic, the availability of substandard medicines in this space could be called like an epidemic. So why not to start working the same way we did it with the pandemic, trying to address all the needs in sexual reproductive health? Thank you so much.
We thank Mariana Wilner very much for that clear presentation. And here we can see that link between fostering access to medical products and the particular area of sexual and reproductive health rights. And we do note that countries such as South Africa and Brazil that recognize the right to health for all are making extensive efforts to ensure that these are also included in the essential medicines list, which is an important pathway, as Dr. Wilner mentioned, to ensure access for all. And with regards to substandards, it's always important to note that if we don't have access, of course, that is a pressure point for then these medicines of lack of sufficient quality, and perhaps local production is also linking back to what His Excellency Ambassador Nkosi said, that can be a pathway to producing in the regions medicines that are both of quality but also affordable and produced in the regions. I'll now pass the floor to Ms. Camila Gasparro. She's the coordinator of maternity and mortality response unit in Brazil. Very glad that she's with us. And she will bring us back to the topic on what are the priorities for Brazil in reducing inequalities and to improve access to maternal health services for all in Brazil. Thank you.
It's okay. Good morning. No?
Afternoon.
Good
Yeah,
afternoon. It's okay. Right. Good afternoon. First of all, thanks a lot for South Center. I'm a nurse, and I am actually the coordinator of the maternal mortality response unit in Brazil of the Minister of Health. And Viviana asked us to say about what are the priorities for Brazil to reduce inequalities and improve access to maternal health services for all. Well, as everybody knows, Brazil is an equal country, one of the most in the Americas. We have high technologists and specialists, but for a few % of the population. And which are the inequities we have to face and to reduce. Gender inequity, as well as everybody. Structural racism. Brazil is a very racist country as well. In Brazil, Black and indigenous mothers die twice than brown and white women. Inequity access to education. 30% of girls still study only 6 years in their lives. Difficulties in access to sexual and reproductive rights and medical products. Inequity access to health services in general. Sexual violence against girls and women. Obstetrical violence that unfortunately it's not recognized by medical class entities in Brazil yet. And the pregnancy in adolescents. 2%, that it's approximately 5,000 girls under 16 years old get pregnant for a year in Brazil. Since 240, we are watching the advance of political and moral conservatism in Brazil. And we can see that abortion rights, healthcare in case of sexual violence, prevention of sexually transmitted infection, and sexual education are being attacked. We have policies for abortion that authorizes in 3 cases by sexual violence, risk of mother's death, and anencephalic babies, but so many services are being unstructured and professionals persuaded, as well as curtail the debate about sexuality and gender in public schools of all levels. Since 2023, we have changed the president and the named left government returned. Nevertheless, the Congress is still full of politicians that continues the anti-gender and anti-human rights policies, especially for women. It's still difficult. Nowadays, we say we are in a coalition government trying to bring back and actualize the guidelines and evidence-based policies for women's health. And we, the women, we are still defending our rights day by day. We updated our maternal and children's services organization and gave the name of Rede Aline Pimentel. Aline Pimentel was a 22-year-old Black and poor woman about 6 months of pregnancy that died of eclampsia, but most of all, her death was internationally recognized as a violation of human rights because she was very badly treated in the health services, and her symptoms and complaints were not respected. Brazil was condemned by the Committee of Elimination of Discrimination Against Women in that special case as violation of human rights. And we did her name for this policy because we need to look and face problems like structural racism and social class inequities. Otherwise, it will not be possible to reduce maternal mortality. Brazil decides to agree on specific and quite ambitious goals. For 2027, we must reduce mothers' mortality in 25%, but we have specific goals to reduce 50% for maternal death of Black women. To achieve that, we are working with social movements that have a large participation in policies in Brazil, listening to their needs and claims, and inducing the states and municipalities to plan and make specific investments to serve that population. Till the end of 2027, we will probably have more 60 maternities and birthing centers in most distant cities in Brazil. The health minister and a partner organization named Instituto Fernandes Figueira, Fiocruz, we developed a strategy called 10 Steps for Obstetric Care to Reduce Mothers' Morbid Mortality. And we're now offering a couple of clinical specialists, 1 midwife nurse and 1 obstetric gynecologist, to discuss and implement the 10 steps as a qualifying strategy to update obstetrical care in Brazil. We're starting now in the second half of 2025 a national specialization course to train 586 midwives nurses, prioritizing locations with a bigger lack of health assistance and higher maternal mortality rates. We invest in midwife nurses and in the right to a freely chosen companion at the time of birth as strategies in addition to others to minimize obstetrical violence. The health minister has been working on a specific project with indigenous communities as the Yanomami in the state of Roraima and the Chavante in the state of Mato Grosso, and with Quilombola communities in the Marajó archipelago. For example, developing professional training for obstetric emergencies and sexual and reproductive rights, training primary care nurses to introduce intrauterine devices. Brazil has a triple responsibility with health system, and most of the medical products are purchased by the municipalities and another part for the states, but the contraceptives are centrally purchased and distributed to the 27 states for safety reasons. In Brazil, the government distributes oral and injectable contraceptives, preservatives, intrauterine devices, and this year we are incorporating the subdermal contraceptive implant for adolescents of 14 to 17 years old. This means an investment of approximately $2 million in 2 years, only to incorporate the subdermal contraceptive implant. Brazil is investing in valorizing capacitate primary care nurses to insert intrauterine devices and structuring some primary care units to be referenced in long-act reversible contraceptives, the LARCs. We are calling this project as LARC centers, and those centers are discussing to introduce the possibility of vasectomy in primary care too. Brazil has not historical problems with climate crisis, but at the last 2 or 3 years, we're starting to see serious climate crises like extreme drops in Amazonia and floods in the south, besides the accidents with mining dams, especially in Minas Gerais. Those events demonstrate how women are the first population to suffer violation on their rights, especially sexual and reproductive rights. Those girls and women who suffer the most rights violation are the responsible for take care of everything, to fetch drinking water over long distances, make food for all, care the ancients and the children, and so many times they suffer sexual violence and are obligated to take care of those men who did that to them. It is urgent that Brazil develops an emergency strategy, how to guarantee women's sexual and reproductive rights in times of crisis. We work to guarantee that all Brazilian women be able to exercise their rights to sexual and reproductive health and decide when and how they want to get pregnant and have their children. Every day, me and our wonderful team of dedicated women make up and go to work to defend and improve women's health in Brazil. Thank you for your attention.
Thank you very much, Camila. And hopefully with that, we have showcased that is resilient and inclusive health systems is at the basis of advancing on health equity, and we hope that everyone here will join in that effort. As was noted, substantive progress has been achieved in some countries, but there's also an enormous agenda forward, and we're facing strong backlash, both in affordable and equitable access to medical products, including on products for reproductive rights and sexual rights. And as well as that, of course, overall, in many of these agendas, we know that we cannot advance without international cooperation and solidarity. As has been highlighted, the pandemic treaty is a positive step forward. There's still much more to do. We also need positive and inclusive negotiations of the pandemic access and benefit sharing system for pathogen sharing to have that treaty moving forward. So we'll also invite everyone to join in that effort towards effective and equitable conclusion of those negotiations. So with that, we have about 5-7 minutes more before we're kicked out of the room. So we will give open the floor for for some quick points and just emphasize, please, so we can have more interventions to keep those as short as possible. And since I will close afterwards with that, just to mention that there will be a light lunch offered for everyone once we close. Thank you very much. So if I could see if there's any requests for the floor. Yes, I see here first, and then we come to Colombia, please.
Thank you very much. Thank you to the panelists for the excellent discussion, which is, of course, extremely timely. My name is Kelsey Armstrong-Valenchuk from CEHADI, the Global Center for Health Diplomacy and Inclusion. We're actually co-organizing a side event tomorrow at 1 o'clock at the Intercontinental Hotel, where we will be presenting some research about how health does or doesn't appear in UPR cycles in the recent cycles. So looking at how health is incorporated into those reports. And of course, I'd like to invite you all to come and join the conversation, but I'd also like to take this opportunity to ask the panelists, in this current challenging global context where we see somewhat of a retreat from international momentum on global health progress, do you see any new opportunities for collaboration on other levels or via other platforms such as the UPR? Thank you.
You will hold on questions for a last response from panelists after we have the interventions from the floor. I see Colombia, followed by Dominican Republic.
Thank you. Thank you very much for this interesting conversation and event. I don't have a question. I just want to make an invitation that is part of this agenda. We want to invite everyone to participate in the 7th session of the International Conference on Family Planning, which the government of Colombia will co-host at the end of the year, November 3 to the 6th in Bogota, Colombia. This event marks the first time this conference has been held in the Latin American and the Caribbean region. And the theme of the CFP 2025 will be equity through action, advancing sexual and reproductive health and rights for all, arising directly from the ICFP community and calls for the innovative solutions and concrete commitments to address health and systemic inequalities worldwide. We want to use that opportunity to focus our discussions on innovative and hopeful ways to reinvent cooperation, ensuring that the rights and progress we've achieved remain strong and active in response to the humanitarian crisis created by the resurgence of ultra-conservative and far-right movements. In this context, a key opportunity in that forum will be the interministerial meeting, where we urge the delegation present to support and propose strategic alliances among actors in the Global South and our civil society's allies. Thank you very much.
Thank you, Colombia. Dominican Republic, please.
Good morning. Good morning, everyone. I want to thank the panels for the presentation and for inviting us. It's not a question, just to reaffirm the position of the Dominican Republic through its Ministry of Public Health reaffirms its strong commitment to the right to health, which is a basic human right recognized in our Constitution. We promote a health agenda based on social justice and international cooperation to ensure health equity. We are working to make sure that everyone has fair access to essential health services and products like vaccines, medicines, and tests. After the inequalities shown during COVID-19 pandemic, we fully support the World Health Organization Pandemic Agreement to guarantee fair and timely access to health resources. The Ministry of Public Health updated our national list of essential medicines. It grew from 797 medicines in 2018 to around 1,000 in 2024, with the number of active ingredients risen from 400 to around 900. These are available to the whole population, showing our commitment to continuous and equal health. On sexual and reproductive health, we are expanding services with respect of cultural differences and without discrimination. A major effort is partnership between the Ministry and the National Health Service to open 39 comprehensive care unit to adolescents and for everyone. Those units offer physical, emotional, and social care, health services like physiology, gynecology, and family medicine. From the Dominican Republic, we reaffirm our full commitment for a public health system that is based on human rights, focused on people, and rooted in justice. Thank you.
Much. Cuba?
Thank you very much. I will be brief. I just want to start by commending the work carried out by the South Center on shedding light on promoting these discussions about the right to health. Just on a quick revision, I recall a side event held in the middle of the 78th World Health Assembly regarding decision, also a previous one held in this session last week with the leadership as well of South Africa and Brazil, along with the Cuban mission and the rest of side events that we are going to hold these sessions, including this one. And I want to finish with just a point that connects all interventions that were made today, and that is the need to analyze and address structural challenges that impede and hinder access to the right to health, to medicines, to vaccines, and other medical products. There was a talk about intellectual property rights schemes, the lack of provisions or insufficient provision of means of implementations, but it is also important to address other challenges such as coercive measures, unilateral coercive measures that some countries, as mine, suffers and hinders a lot our capacities to promote an equitable access to that right, and the need for renewed international cooperation and solidarity. I think that's the basis, including South-South cooperation in difficult times where there is insufficient provision of means of implementation from donors and developed countries. We, as fundamentally countries of the South, should foster South-South cooperation and identifying our gaps, our challenges, but also our opportunities that we can together, go along and move forward regarding the right to health. Thank you.
Thank you very much. We won't have a space for reply to answers, but we hope that for this issue on universal health review, perhaps tomorrow, those of you like to join, it was invited tomorrow at 1 p.m. could continue that discussion. And of course, we heard about the important conference that will take place in Colombia in November. We look forward to also supporting that. Just to thank again all the panelists, also Daniel from South Center as well for helping to make this possible, all those that are here, and Ambassador Nkosi for your presence and your strong words. So please enjoy the lunch as you walk out. Thank you very much.